Hi, welcome back to Majority 6440, Episode 2. I'm Sophie.
I'm Claire.
And I'm Maggie.
This episode is going to be on COVID and all the different facets of that. But before we get there, my question kind of ties into our intro is, what is your favorite park in St. Louis? Except there's a caveat, it cannot be Forest Park. Go.
I would have to say my favorite park is Castlewood State Park, because there's a cool little hidden cave. And I live in Baldwin, so I'm very close to it. If you live close, you know exactly where to find it. And I know where to find it.
As a proud member of the Missouri Botanical Garden, which I know it's not a park, but it's practically a park. It reminds me of a park. I have been a member since I was 11, when you didn't even need a membership, and I go there all the time. Unfortunately, I haven't made many trips during COVID, but it's always my go-to when I come home from college or with family for the Christmas lights, the light shows, all of that. And so it has more plants and trees than any other park I know. So I'm going to consider it a park.
And not to be one-dimensional, but my favorite park is Barrow Park in St. Louis, because that is where the greatest soccer team, maybe ever, practiced and played. It was the team from St. Louis that have 5 St. Louis guys on it that beat England. If you're Irish like me, that's a pretty big deal. St. Louis and beating the English. We love that. So Barrow Park all the way.
Okay, so to start off with, we're going to list some facts about how COVID-19 has impacted minority populations throughout the United States. And before we get into the numbers, I just want to say that the conditions in which people live, work, and play in definitely contribute to their health. Over time, conditions can lead to different levels of health risk, needs, and outcomes among certain racial and minority groups. So all of this information that I have before you is going to be from the Center for Disease Control and Prevention, also known as the CDC. And what they do in their research is they use a technique called age adjustment. And with this technique, it's basically comparing populations when the age profiles of certain populations might differ than others. So they take that into account, basically, is what I'm saying. So to begin, as of June 12th, 2020, age-adjusted hospitalization rates are the highest among non-Hispanic American Indian or Alaska Native and non-Hispanic Black persons. Then that's followed by Hispanic or Latino persons, and then all 3 of those groups, the hospitalization rates are way higher than they are for non-Hispanic white persons. More specifically, for non-Hispanic Black persons and non-Hispanic American Indian or Alaska Native persons, these groups have a hospitalization rate approximately 5 times that of non-Hispanic white persons. And then for Hispanic and Latino populations, their hospitalization rate is approximately 4 times that of non-Hispanic white persons. So now I'm just going to tell you a little bit about some of the reasons that the CDC have listed on their website as to why COVID-19 is impacting racial and ethnic minorities. So basically, one of the reasons is housing, and due to institutional racism in the form of residential housing segregation, people, are in closer contact with each other. And then when you think about tribal reservations and or Alaska Native villages, people also live in compact spaces where it's harder to socially distance and things like that. And then some communities with higher numbers of racial and ethnic minorities in the United States tend to have higher levels of exposure to pollution and other environmental hazards. Like I mentioned, reservation homes are more likely to lack complete plumbing also compared to the rest of the nation, which may make, things like hand washing and disinfecting things a little bit harder in these areas. And many persons from racial and ethnic minority groups live in neighborhoods that are farther away from grocery stores, farther away from medical facilities, or they just might lack safe and reliable transportation. Thus, they have to rely on public transportation, which is definitely not the preferred method of transportation during a pandemic. And due to distance from these stores and facilities, it makes it harder to stock up on supplies that would allow people to stay at home and, receive care if they're sick. And then also people who live in multi-generational households and multi-family households, which tends to be a more common thing among racial and ethnic minority groups, may find it harder to isolate themselves or to isolate the sick members of their family in spaces where household may or may not be limited. Again, certain racial and ethnic minority groups are overrepresented in certain areas, such as jails, prisons, homeless shelters, places where people live and congregate within their environments, which makes it especially difficult to slow the spread of a pandemic. And then in all age groups, non-Hispanic Black persons are more likely than non-Hispanic white persons to report not being able to see a doctor in the past year because of cost, which is healthcare is a whole nother debacle that we can address. And then lastly, I just wanted to, for all our St. Louis viewers, just wanted to plug a locally based nonprofit racial equity project going on in St. Louis called the Before Ferguson, Beyond Ferguson Project. And specifically, they're focused on the 63106 zip code. And this project tells the stories of Black families who have been impacted by this pandemic, and this zip code, how it's different from, let's say, the Clayton zip code, for example, where living conditions are better. So definitely check that out for more local stories.
Build off Claire's piece on how COVID is affecting minorities, and I'm going to specifically talk about immigrants. Warning, I'm going to make pretty much no distinction between what we would call illegal or undocumented and documented immigrants, because really both communities are affected the same way. And the first thing I'm going to talk about is in immigrant communities, there's, especially under this current administration, there is a lot of fear around going to a hospital or anywhere where you have to give documentation, even if you are legal. So a lot of immigrants who might be positive or might need a test are going to be afraid to go and get that test, which is then going to increase the rates, because by the time you're showing symptoms, or you've been showing symptoms for a few days and they're worse, and now you need that test, the odds are your entire family has already been exposed to COVID. So that's one concern in immigrant communities. Another is that a lot of what we would consider essential jobs, such as in Florida, it's landscaping, but farm working in California, meat processing, pretty much everywhere, a lot of those jobs go to immigrants, both documented and undocumented, which means that these people are on the front lines, often without healthcare, not receiving government stimulus checks, especially if they're undocumented, expected to go into work, work these long hours in unsafe conditions. And a lot of them are then getting COVID, which is dramatically affecting the population even more than it would if they had just been in these jobs. So to highlight that, to look at Florida, because our example is just probably always going to be Florida because we're embarrassed to talk about Missouri. So it makes us feel better to talk about somewhere else. But in Florida, landscapers were deemed essential workers from the beginning. So even though Florida hasn't really shut down, when they were, these landscapers were still working. And a large population of these landscapers are Guatemalan Mayans, especially in Palm Beach County, where 30% of the population, which is about 80,000 people, so 30% of 80,000 have tested positive for COVID because they've been going into work from day one. They've been in all these rich people's houses, on the golf course. They've never had a day off. They're all testing positive now. And in a state where hospitals are overrun, and we all know that there's medical biases against minorities, they're getting less treatment than they should, which is dramatically affecting them as well. The other thing is, Claire talked about how there's a disproportionate amount of minorities in prisons and jail. Well, we also know that we have immigrant detention facilities in America. ICE has admitted that they have accidentally transferred immigrants who were COVID positive from one detention facility to another. So they've then increased the rate of people who are come in contact with COVID. In a particular case in Farmville, Virginia, there's 268 confirmed cases out of the 360 immigrants who are there. Really, it's just that there's poor conditions in a lot of these immigrant communities. They don't have access to the same resources that people do. Even if they do have access, they're afraid to use the access because for the past 4 years now, the Trump administration has made it their mission to deport as many of these people legally or illegally as possible. ICE has not taken any precautions for the over 22,000 people who are in immigration detention facilities. And their proper precautions are spraying immigrants with disinfectant. So that's kind of what we're looking at with, that's what we're looking at with immigration populations. And so a lot of people in detention facilities, and Maggie's going to bring us all up to date on kind of the general national and CDC plan about school reopening.
what I'm going to talk about for the next couple minutes is just my own personal observations, some information from the CDC about schools reopening, but it's mostly so many options, so many schools, everyone's doing slight variations with everything. But essentially, what all schools are doing is they're having a number of options or just one option. And so often these entail fully online, all virtual things, no in-person, and then a mix, which I learned a new term during quarantine, which is hybrid. So it's a little of both in-person and virtual, and then fully in-person, which I haven't heard of one school doing that, but a lot of schools are at the point in which they have students on campus or students coming into school. And so the CDC has ruled that the lowest risk, of course, is all virtual. More of a risk is having the smaller classes, no mixing. So having students in one classroom for their only class, or hybrid, so they only come in once a week and then have the rest online. Staggering time so that there's not a crowd emerging anywhere. And then, of course, 6 feet and mask at all times. And then the highest risk, of course, is those schools that have a lot of mixing, have large student bodies, have those big lecture halls, or just with middle schoolers and high schoolers, just all of them in the hallways, lockers, lunchrooms, all of that. So, of course, all the people that are going back, they will be in mask and social distancing at all times. In terms of college, that excludes your living space. My dad is a teacher and is a high school teacher and has been having conversations about how will lunchrooms look like, what's going to happen with that. And I imagine lots of 6 feet going on, or eating maybe somewhere else. And so the breakdown with elementary schools is that they're hoping to go in person, but social distance. My sister's a first grade teacher, and under third grade, you're really not required to wear a mask, just because of little kids and breathing and the coordination of that, which poses a risk of teachers. And my heart is with all the teachers right now, trying to figure out whether they take the risk, go to school, engage with their students all day, then come home to any family members they may have. It's been heartbreaking to see the teachers scared and writing wills and protesting so that they don't have to go back to school. And I don't blame them. And I think elementary and middle school and high schoolers are more at a risk of college students, because you go for 8 hours and then you are exposed to your family, to your grandparents. At least for college, there can be some sort of containment. And then personally, I can just talk about my college, and I go to a small liberal arts school, so we have some benefits in having a smaller population, a smaller campus where we can spread out, where we have small classes, where we can stagger our times, and where we can spread out in our lunchroom and our libraries. And we will be tested every week because we have those resources. But of course, masks will be worn at all times. Most extracurriculars will be online. Sports have been virtually canceled.
We're going to transition now from kind of just facts and things that we've looked up to some real talk. So if you don't want to hear us talk, turn it off. We're not offended. We won't know. But so Maggie's kind of talked about going back to school. Claire, you start later than the rest of us. You start October 1st is usually your first day of school. How is that? Like, do you think you're going to be back? Do you guys have a plan? Have they been giving you details? Because that's another question. Kind of what is that? How are your feelings on going back to school?
So personally, I go to the University of Chicago. I'm going to be a junior. I would prefer to just have all online again rather than to do the mixed classes like they're doing. We have started October 1st the past 2 years, but we're actually starting September 28th. So it's a little bit earlier, but not really a big difference. They kind of were late with the decision in the game. And I think that's because we didn't get out, since we start late, we didn't get out until mid-June. So I think they just kind of thought, oh, we have more time to make this decision. Let's just wait and hold off. But it kind of sucks because housing is only 60% capacity. So those of us who were planning on living in the dorms had to find somewhere to live ASAP or choose to be entirely at home, which is a possibility. So while there are some classes that are going to be offered in person, if you so choose, you can be online completely. The option for in-person classes is still there for you. And yeah, so that's kind of what we're doing, but I wish we were like University of California and just would have said online earlier in the summer, so we would have known and wouldn't have to make these last minute decisions and rash decisions, not really thinking through things.
If I may add, I understand because money has been a big financial factor in all of this. And a lot of colleges want to still generate the revenue that they do, but students don't want to pay full tuition for all online. And that's what a lot of colleges are struggling with, as well as students.
So that's kind of my next question is, I know both of my parents are high school teachers. It's very scary for me to think about them going back, mostly because they go back about 2 weeks before I go back, which means like we live across from my grandma. When they go back to school, she stops coming over because we can't socially distance. We can't kind of quarantine with her. And then I go to school in Boston. I have to fly to get there. And so that's a little concerning. And then, you know, some of us are student workers, so we'll be working. Do you guys think that we'll be on campus the whole time? Do you think students are going to obey the rules? Do you think universities have been clear enough about the rules? Because I know, I can hear people yelling, everything's fluid, things are changing day to day. Yes, but if that's the case, then like Claire said, shouldn't we all be the California school system and say it's not safe or it's not worth risking? Because the truth of the matter is, if you're bringing students back, that means you have X amount of your student population that you are okay with getting COVID. You have X amount of your faculty that you are okay with getting COVID. You have X amount of your staff who, especially at the universities we go to, are probably minorities and not white, because that's just how universities, especially rich upper class universities, deal with, that you're okay with getting COVID. How do we feel about that? Like, should there be a percentage of people that can get it? Or should we be saying no? What are your thoughts on that?
Well, there's a lot to handle in that. But I honestly don't think college students are going to obey rules as much as they should, especially because a lot of the people who are in dorms are going to be freshmen, majority freshmen, who are eager to get to college, get the college experience. And the college experience is very much not quarantine. It's very social. And that's just the way it is. So I can imagine there's going to be a lot of people out partying, doing other college things with other people. I don't know if there's any like hit point that UChicago has stated, like we're only gonna get to this point and then we're done, we're gonna call it. I don't have that information, but I know that the city of Chicago just had to shift back to phase 3 of their reopening plan. They were in phase 4. They decided to cut it back, I believe, yesterday. And so the fact that the city doesn't have its stuff together makes you think that the school is not going to have its stuff together either.
At the start of quarantine, I saw those masks, people made masks that said this was preventable. And at first I didn't like those because I thought, well, no one can control the virus. We don't know, we didn't ask for it. It's a tragedy. But now I'm like, yes, this could have been preventable the way we've handled it. When I left in March, I thought I'd have a normal summer. We all did, and we all thought we would. And now I am expecting my whole sophomore year to be disrupted. And I can genuinely say that Donald Trump has affected every single American at this point because of his lack of controlling the virus, because he could have and didn't. But I hope people are responsible. I think it takes every American now to do their part.
And so to kind of go back to earlier things before school, but it ties into school because I think colleges kind of represent the way that our society is organized. You know, there's a lot of white students at these institutions, especially the 3 that we go to. There's a lot of class issues. There's a lot of, you know, staffers are on the front lines. At BC, currently athletic personnel are getting tested. Male workers are not. I don't know if anybody else sees a problem with that, but like I do. I'm going to give you your, right, you're going to go to volunteer practice because you're not going to have a season and I still have to give you your mail, but it's okay. And I love athletics. Like I want us to get tested with them. I don't necessarily want them not to get tested. That's not what I'm saying. Everybody should get tested all the time. Let's not start fighting about tests. But society, we also have, with COVID going on, we have this massive Black Lives Matter movement. And I think one of the challenges of that movement is it's about police brutality, but also we're seeing all these healthcare discrepancies. And that's also a factor of a racist system. And so how do we, in these times when we're supposed to be quarantining and we're supposed to be socially distancing, how do you, A, support Black Lives Matter, but B, also expand the movement beyond just the one topic that the media seems to want to push it into and expand the conversation?
I've been interested in the dialogue that has been going on around Corona doesn't discriminate, or this is the great equalizer, we're all globally suffering, in which some of that may ring true, but for people of color here in America especially, their social determinants of health lead them to be more at risk for Corona. And we see that in many different options. So I read in my sociology class this past semester that 4 out of 5 people of color have to work essential jobs here in America. And so they are more at risk. And then they have less access to healthcare, and where they lived, often in close quarters, and housing that's closer to each other. And so America's system has been set up to discriminate health-wise. A pandemic is not discrimination proof. And we're seeing that a lot, and we're seeing our government lack in action about that. And I'm just scared because it's just been so prevalent of how racism is within our healthcare system, and especially with minorities, including immigrants as well.
Okay, that was great, Maggie. Thank you for sharing that. A lot to unpack there. I just want to say quickly before we end that a more feasible solution to this problem would be universal healthcare. Therefore, we don't have the problems of minority, fearing doctors and not being able to pay the cost of seeing a doctor, and or the immigrant population not wanting to show their documentation while they're receiving healthcare. And then, the less likely, less feasible solution would be ending racism. People would be healthier, but, shoot long and land short, that's okay.
So obviously these are uncertain times. We have no idea. Some of us have no idea if we're going to make it to school. Some of us have no idea when we're going to get sent home from school, but there is something that as St. Louisans, we are all very sure of, and that is that Fitz's is going to make root beer. So our closing question, Maggie hates Fitz's so much she just disappeared, is that what is your favorite flavor of Fitz's root beer and why?
I'll go first. Strawberry, because it's the best flavor. Unfortunately, you can't find strawberry in stores, which kind of contradicts my point that it's the best flavor. But strawberry is really good. It definitely beats strawberry Fanta and strawberry Vess. Strawberry.
I accidentally turned off my video, but it was timely because I really don't like root beer. I'll go to Fitz's, eat their ice cream, eat their food, but I just can't do root beer any type, any flavor. Even cream sodas, even dark soda, even soda. I just don't really drink soda, but I'll make a pitch. I've built my brand around kombucha, and I recommend it. It's good for your gut. It gives you natural energy that's sustaining, and that it just leaves you refreshed and healthy. And I just hope you all enjoy kombucha over root beer.
And it tastes like you're drinking vinegar. End of story.
Majority 6440 does not endorse kombucha. We only endorse local St. Louis things that we know we can plug because
there's local kombucha brewers. You can get it on tap. There's a kombucha restaurant even here in St. Louis in the Grove.
Sorry, Maggie, I don't drink vinegar for fun.
Wash U has kombucha on tap in their dining hall.
We are a democracy, therefore the majority rules. Claire and I do not endorse. This endorsement is null and void. Maggie, make your own video about kombucha if you would like. I'm gonna go with just classic root beer. Claire's gonna make fun of me for being boring. She does call me boring pretty much once a day at this point.
It's good though. I can't disagree. It's good, but it's not strawberry. So
it's classic. It's kind of my superstition for the NWSL Cup right now. Pretty much anytime the Dash is playing, that's my team. I have to drink at least part of a root beer so that they win. It's worked so far. Hopefully it works tomorrow. Fingers crossed. But so that's kind of my weird thing. It's just normal Fitz's root beer. You can't go wrong. But Thanks for hanging with us. This has been episode 2. Tune in next time.